Good evening to everyone and welcome to today's session. Medical and surgical nursing is one of the major subjects out of the 14 subjects which are tested in the staff nurse recruitment exam. There are about 1800 MCQs on the medical and surgical nursing we are going to discuss, which is going to help you for the answering of the questions. There will be about 10 to 12 questions on medical and surgical nursing out of 100 questions in the various staff nurse recruitment exams. So you are listening to Dr. Murali Bharadwaj, and every day evening 9 p.m. to 11 p.m. and morning 10 a.m. to 12 in the afternoon, we will have a live broadcasted session, and you can be able to join the session live online from anywhere across the country. So let's make the great beginning and keep interacting. Any questions you have, you want me to go slow, go fast, I can be able to do that. You can chat into the interactive live chat. So let's make the beginning. Removal of the non-viable tissues from an open wound to promote the healing. What do you like to call this as? We call this as debridement. Debridement. This was a MCQ from the AIIMS Raipur staff nurse recruitment exam. So you should remember, this is a classical example. A 43-year-old male with necrotizing fasciitis, a lot of inflammation. The necrotic tissue from the left leg has been surgically debrided. So that is what you should understand. Now, out of the various kinds of burn injuries, what is the most common type of the burn injury? I'm able to see 4 of you online. Very good. Today, a lot of nurses across the country have subscribed to our channel. Please don't forget to click on the bell button so that the moment there is a notification, once we start a session, you get a notification, right? So keep typing your answers. That is how you can be very actively participating in this session. So the most common type of the burn injury is the thermal injury, is what you should remember. Now, whenever burns hota hai, there are 3 kinds of injuries. One is thermal injury. Thermal ka matlab temperature. The heat will cause the injury. Because of that, there will be scalding. Scalding ka matlab, if the skin is there, there will be a collection of the fluid underneath the skin, and there is a burning of the skin. So the scalding and the contact with the hot substances, frostbite is a type of thermal injury. So thermal burns are the most common type. Then chemical burns are the second type, and electrical injuries, the different types of burns. Now, which chromosome contains the ABO locus? हमारा blood groups जो होता है, A group, B group, O group, etc. कहते हैं ना? So you should remember, O group is universal donor. किसी को भी O अपना O plus, O positive, they can be able to donate the blood. Donor. Then AB is called as universal recipient. Anybody's blood group they can be able to receive, right? AB positive, they can be able to give to anybody who has a positive blood group, and either A or B or anybody. So they can receive. So from anybody. So universal recipient. So A group hai ya B group hai ya O group hai. Where is this decision made? It is in the chromosome 9. You need to remember. बहुत बार staff nurse recruitment exam में this question has been asked. It is a long arm of the chromosome 9. The shock which results from the allergic reaction, इसको क्या कहते हैं? इसको कहते हैं anaphylactic shock. So anaphylaxis, you should know the word anaphylaxis. What is the meaning of the word anaphylaxis? Whenever there is any antigen, what is the meaning of antigen? See, रूपा है और गीता है. गीता का स्किन is different from, रूपा का स्किन is different from गीता का स्किन. अगर आप रूपा के स्किन को लाके गीता में लगाए तो, नहीं तो गीता के स्किन लाके रूपा में लगाए तो, obviously the Rupa's body will react and reject it, right? So how does the body respond to reject somebody which is not mine, right? If you bring your liver and give to me, how will I reject it? For that, I produce antibodies. I produce antibodies to reject your tissues if they are put into my body. So your tissue is called antigenic. And to reject that, if it is not mine, I produce antibodies. So a antigen जो होता है, ये जाके one of the white blood cell called B lymphocyte, उसको sensitize करेगा. And that will produce something called immunoglobulin E. Immunoglobulins को कहते हैं antibodies. ये immunoglobulin E जाके a basophil बोल के another white blood cell है, उसके ऊपर जाके बैठेगा. Right? Now, future में अगर आइंदा future में once more if you happen to expose them to the same antigen, then this antigen come and bridges to this antibody, and that will make this cell. What is this cell called? Mast cell. इसको क्या कहते हैं? Mast cell. Mast cell immediately histamine बोल के एक substance को release करेगा. किसको release करेगा? Histamine को release करेगा. ये histamine जाके blood vessels रहते ना? Blood vessels में आपको endothelium बोलते हैं. Blood vessel wall के ऊपर बैठे हुए cells को endothelium बोलते हैं. ये endothelium will prevent the blood inside the blood vessel from leaving the blood vessel, from going out. But this histamine will increase the permeability of the vessel and make the fluid inside the blood vessels to come out. And that will collect and swelling occur, which is called as edema. So this kind of a reaction is called anaphylaxis. जब anaphylaxis होता है, the blood, the plasma, which is there inside the blood vessel, is leaving out because vascular permeability, the blood vessel ka permeability is increased by the action of the histamine. So the plasma, that is the blood inside the blood vessel, कम हो गया. जब blood vessel के अंदर blood कम हो जाता है, then that lead to development of shock. मगर ये shock किसके वजह से हुआ? ये shock हुआ था anaphylaxis के वजह से. Anaphylaxis क्या होता है? जब एक एलर्जन और एंटीजन बी सेल को स्टिमुलेट करेगा, बी सेल जाके मास्ट सेल को स्टिमुलेट करेगा, और मास्ट सेल नेक्स्ट टाइम व्हेन वंस मोर दैट एंटीजन का एक्सपोजर हो गया समझो, then that will cause the release of the histamine is what you have to basically understand. So this is how typically all that fluid comes out and lead to development of swelling. This is called what type of shock? Anaphylaxis is what you need to remember. So that is what examiner is asking. The shock which results from the severe allergic reaction को क्या कहते हैं? इसको कहते हैं anaphylaxis is what you need to remember. So how will you recognize that there is anaphylaxis? Very good to see 5 online students. Roja from Vizag, very good, is asking why the eosinophil count will increase in allergy, sir. बढ़िया, बहुत अच्छा क्वेश्चन पूछा रोजा. So whenever there is any allergy, right? So the allergy will make the WBCs, white blood cells. What are the types of white blood cells? Do you know, Roja? You have neutrophils, eosinophils, basophils, etc. So this basophils are the ones which will go and make mast cells to produce histamine. That is one way. Second, the allergen will make the immunoglobulin E antibody to become produced. That immunoglobulin E will make eosinophil count to increase is what you need to remember. Got it? Now, Roja is very sure why the eosinophil count will increase in allergy, right? Now, these are called hives whenever there is anaphylaxis. Inside our eye, we have conjunctiva. So there is a swelling of conjunctiva. These are the things that happen whenever there is an edema, is what you need to remember. So, Roja, tomorrow you have done diploma nursing or BSc nursing. What did you do? Right? So, you can bring a lot of your friends also to join the session. So ask them to subscribe and then click on the bell sign. The moment we start a session, you get the bell sign, ring up so that you can be able to participate. The great advantage is everyone has got a YouTube channel. I mean YouTube in their smartphone. So it's very easy to participate from anywhere. You can be able to participate in the discussion. So that is the purpose with which these sessions are started. So remember that we will totally discuss 8,000 MCQs from the 14 nursing subjects, right? And by the time you revise this, you know to crack any kind of a staff nurse recruitment exam, right? Now, whenever there is an anaphylaxis, what will the problem? There's a lot of edema. Edema is the fluid which is leaving the blood vessel, right? So that can lead to blockage of the airway. So there can be problem in breathing. The BP will fall down. Circulation mein problem hai. So how do you identify? Generally, anaphylaxis is very acute reaction. बहुत acutely होता है anaphylaxis. And there can be a life-threatening airway blockade that can happen. That's the reason, as a nurse, what is the thing that you need to do? Call for the help, make the patient to lie flat because he's having hypotension. Raise the patient's legs and then get ready with adrenaline. Adrenaline is going to make the anaphylactic shock to reverse. So fundamentally, anaphylaxis mein BP kyun gir raha hai? Why the BP is falling down in anaphylaxis is a very important question. BP is falling down in anaphylaxis because in anaphylaxis, the mast cells are stimulated, releasing the histamine, and that histamine is increasing the permeability. Permeability means the blood vessel become very leaky, and that will make the plasma to leave out of it. So that is causing the low BP. If you happen to give adrenaline, it's a strong vasoconstrictor and maintains the BP. So what are the other important things that you should get ready when the patient is having anaphylaxis? You should get the endotracheal tube ready so that you can establish the airway, high flow oxygen, then IV fluids, then hydrocortisone, and you should have pulse oximeter kept ready to monitor the saturation of the oxygen. ECG should be ready and BP apparatus ready. So these are the things that you need to keep ready in order to attack an attack of anaphylaxis is what you should remember. Now, the graft between identical twins, isko kya kehte hain? What type of graft it is? You should remember, autograft ka matlab hota hai, if I remove the skin on my thigh, and put it on the face. That is autograft within a person. Then identical twins के बीच में अगर रामू और भीमू are identical twins, भीमू के बदन से किडनी को लेके आप रामू के अंदर लगाए तो they both are identical twins. That is called isograft. Then between a person and a non-identical person, that means वो twin नहीं है, इसका twin brother नहीं है, दूर का रिश्ता है. अगर यहाँ आप if you happen to do the grafting, that's called allograft. And if you happen to bring from other species, humans are all same species, chimpanzee, or if you bring it from monkey, then you basically call it as xenograft is what you need to remember. Then what do you call? You call it as xenograft is what I want to once more tell you, right? Now, what are the assessments that you need to make in a patient who presents with a breast lump? This is the favorite question, many times asked in the AIIMS staff nurse recruitment exam. You have to be very sure how to evaluate a lady who is having the breast lump. So what do you want to do? So you need to do the examination of the breast in the supine position, examination of the axillary lymph nodes inside the axilla, the lymph nodes ko evaluate karna hai, and you need to do the fine needle aspiration. The fine needle aspiration. They're all the investigations which are being done. Now let us see, as a nurse tomorrow, what are you going to do when you have a lady who came with a lump in the breast? How are you going to evaluate? This is the most important algorithm. Algorithm means what is the procedure to evaluate. So आप ध्यान से review करो. Bilateral breast examination करना है supine position में बिठा के. Supine का मतलब क्या है? If you make somebody lie down with the head looking towards roof, इसको बोलते हैं supine. आप soup कैसे पीते? Soup ऐसे पीते, right? Soup. Supine with the head looking up. Whereas if you happen to sleep with your head looking down to the bed, that is called prone position. So supine position में examine करो. Now there is no palpable mass. You are unable to palpate. Palpate means feel. You are not able to feel any mass. Then look, what is the age? Age is less than 35 or age is more than 35. That is very important. अगर age is less than 35, that is commonly called premenopausal age. Premenopausal age. है तो क्या करना? You need to tell her that you can recheck. You can come for a recheck of exam 1 month later. Because finding palpable masses in the breast is not uncommon in the age less than 35. When a woman is having regular menstruation, then there are hormonal changes that keep happening, and that can bring few masses which will disappear. So 1 month ke baad. Now the patient once more came back, and she said that no, it got resolved. Then you need not worry. Only thing is you can ask her to go for a screening mammograph. Screening mammograph. Suppose if it is unresolved, if the problem is 1 month ke baad if there is a lump in the breast, what do you want to do? You need to refer to the surgery, and you need to ask her to meet the surgeon. That is very important. Suppose if the age is more than 35, then don't ask her to go home and come after 1 month. You have to do a diagnostic mammography. Mammogram के लिए ऑर्डर करना पड़ेगा. सपोज इफ द पेशेंट सेज भाई मैं 3 महीने के पहले भी यही प्रॉब्लम आया, मैं गया और वहाँ मैमोग्राम किया, मैमोग्राम में कुछ भी नहीं निकला, there is nothing in the mammogram, then what do you want to do? So fundamentally you will look whether it is normal or abnormal. So suppose if it is done within the last 6 months, there is no need for doing mammogram. Suppose if the mammogram done in the recent 6 months, if it is normal, then you can ask her to go home and come for a rechecking after 1 month. Suppose if it is abnormal, then you need to refer to a surgeon. So that is the story. If on clinical examination there is no breast lump that you are able to palpate. Suppose if you are able to palpate, तो क्या करना है? एक palpable breast mass दिख रहा है आपको. Then what do you want to do? You need to do the aspiration. Aspiration, typically in a primary care setting. Then वो aspirate करे तो क्या निकला? Suppose if it is cystic, that is containing fluid, then after you aspirate, lot of times the breast lump which is felt become invisible. So if it become invisible, ask her to go home and come for a recheck after 1 month. And if there is no recurrent mass, then look her age. If the age is less than 40, then you need to send for screening mammogram, depending upon her other risk factors. There are some risk factors to get breast carcinoma. Now, if the age is more than 40, then you need to ask her to go for the screening mammogram. So that is the plan if it is a cystic fluid. अगर lump है, palpable है, आप aspirate किया, अगर किए तो cyst में fluid निकला, अगर निकले तो residual mass चले गए तो then you need to go for rechecking. So don't forget this plan. Suppose if there is a residual mass, even after you have drawn the fluid, if there is a residual mass left over, if there is some mass which is left over, then you need to do the diagnostic mammography in her is an important principle. Suppose when you are trying to do the aspiration, कुछ भी fluid नहीं आ रहा है. It is a solid mass. It is not a cystic palpable mass. Palpable mass है, मगर cystic नहीं है, solid है. Then what do you want to do? Suppose if the age is less than 35, then you need to refer her for a surgeon's opinion. If the age is more than 35, then you need to ask her to go for a mammogram and you need to refer to the surgeon. So this is the protocol whenever there is a breast lump. So AIIMS exam, staff nurse recruitment exam ka favorite question. Examiner is expecting, do you know how to evaluate a breast lump? So you are now very confident, right? So don't worry, this PowerPoint, all these slides, everything is available in the nursenoukri.com video library, right? After this session is over, we will upload this video and this PowerPoint also. So you can be able to do the revision very well. All 8,000 MCQs that we are going to discuss, you are going to do the revision. So tension nahi hai. Aram se padho, aram se samajh lo. That is very important. Understand the concepts. You will become the topper, sure shot topper. So breast cyst jo hota hai, how will you identify a breast cyst? It is smooth. It is unilateral. It feels like a cyst. Only infrequently, matlab rarely, it is associated with malignancy. And you can aspirate, and when you aspirate a good number of times, the cyst become impalpable is what you have to basically remember. So once more, tell me, Roja, pre-menopausal, post-menopausal, that's how you look at it. Pre-menopausal, menopause नहीं हुआ, young है, dominant mass है, questionable mass है. Questionable mass doubtful है, मगर वो डर गए क्योंकि टीवी में देखा ब्रेस्ट कैंसर बहुत ज़्यादा हो रहा है बोल के. So re-examine after 3 to 10 day cycle, mass is still present, then you need to basically do the aspiration. If it is cyst, already you know what to do. If it is a solid mass, then you have to do mammography and refer to a surgeon for a excisional biopsy. What is the meaning of excisional biopsy? Excision ka matlab kaatna. To cut is called excision biopsy. So there is something called trucut. Trucut is like, there are two terms you should understand, sister. One is aspiration, other is trucut. Aspiration hota hai, put the needle and then you are drawing, that is called aspiration. Whereas trucut is like you are taking a small piece out when you are doing the excision, and then you will examine under the microscope. That is called trucut biopsy. Need to be ordered. So that is what you should basically plan. So once more, if there is a palpable mass, if you have aspirated, if the fluid came out, then that is a cystic one. Now the question comes. Fluid के color से कुछ पता चलेगा क्या आपको? You know what to do. Suppose if you aspirated a palpable mass and you found bloody fluid, then what do you want to do? You have to do a surgical biopsy, because blood, when there is a palpable mass, if you happen to aspirate, agar blood nikla to, then you have to be careful. You need to be very sure to rule out the possibility of the breast cancer. So that's the reason surgical biopsy ke liye order karna padta. Suppose if it is a non-bloody fluid, non-blood nahi nikla, then, but still there is some residual mass left in spite of taking out the fluid, then that is also an indication for surgical biopsy. Please remember. Suppose if the cyst is resolved after you have drawn, it is non-bloody fluid, then you need to re-examine in 4 to 6 weeks. So if there is no recurrence, then you need to do follow-up. And suppose if there is a recurrence, once more after 6 weeks, if there is a recurrence, then what do you want to do? If there is repeat aspiration you need to do, and you need to consider the biopsy. Now Roja is asking a question. Mammogram plan only for post-menopausal ladies only, na sir? Very good question. See, what do you like me to call you, Roja? Roja should be called as Roja, right? Yeah, that's good. So remember, because last 20 years, thousands of doctors for their postgraduate medical entrance, I have given coaching even today. So I got habituated to address people as doctor. So, but anyway, I'll say Roja. Roja is our representative sister, right? So now the question comes. When you do the mammogram, typically if the breast is very thick, fatty breast, then it is very difficult to assess using the mammogram. Mammogram ko interpret karna difficult ho jata. That is the reason generally premenopausal women, their breasts are very thick. So that is the reason the mammogram is a preferable one after 40 and difficult to interpret before 40. Difficult to interpret before 40. Difficult to interpret. That is what you should basically remember. You understood, Roja? Good. That's good. So that is the great advantage. If it is a live class, hundreds of students are sitting, it's very difficult to ask question to the teacher. Whereas online you can chat, you can ask questions, you can do anything, right? Yeah. So tomorrow Roja is going to bring another 100 students in her classmates, right? Now, let's look at the breast pain. Sometimes patients come with breast pain in the breast. How are you going to evaluate the patients who presented with breast pain? Once more, you should look premenopausal or whether postmenopausal. Postmenopausal hai to mammogram karo, mammogram normal hai to reassure karo or ghar bhi jao. That is very important, right? Now, suppose if the pain is persisting, then you need to document how severe is the pain. There is something called visual analog scale. Visual analog scale. Matlab, you will take 0, 1, 2, 3, 4, up to 9 you call. You will ask, kitna pain hai? In the 0 to 9, what is the level of your pain? Suppose if the patient says, oh, my pain is about 8 level, doctor, then the pain is more severe. No. Kali 4 आना है, 8 आना, 12 आना भी नहीं है, kali 4 आना pain है. Then that is called milder pain. इसको बोलते हैं visual analog scale. Then lot of times the breast pain is because of a condition called AND. AND का मतलब क्या होता है? A for abnormal, right? Abnormal. A means 1 minute. So A means aberrations, not abnormal, aberrations. Aberration का मतलब होता है something which is, suppose if somebody is having a very long nose, everybody has some size of nose, some little more longer nose if somebody is having, that's called aberration, right? So other than little away from the normal look is called aberrations of normal development and involution. अच्छा, इसको AND कहते हैं. See, the breast is a tissue which continuously keep developing throughout the menstrual cycle. So it is like a factory. When estrogen is more, the development is higher, right? So when this development is normally happening high, and also it will be involuting. Involuting means it will be once more reducing, once more increasing. That's how the growth inside the breast will be. So if there are any aberrations in this normal development and growth and involution, इसको कहते हैं AND. AND जो होता है, it will present with pain in the breast. So, but it is very benign. There is nothing to worry. It won't lead to any cancer. For such people, to provide the relief to the pain, primrose oil is a very good choice that you need to basically remember. And suppose if the pain is not relieving, it is very severe, then the choice is to give danazole. Danazole is a medicine that you need to remember. DANAZOL. Danazole is the one which is basically preferred. So that is how you approach the breast pain, the breast mass, what to do in a case when a woman presents with breast pain or breast mass. Now, the next question. The most effective and a safe way to administer the chemotherapy drugs. Some of you are going to work as the specialist nurses in oncology unit. So you must be very sure. So always it is the central venous catheter. Central venous catheter is the most effective and safe way. Now let us talk about it. You need to know a bit of anatomy to understand what we are doing when we are passing a central venous catheter. You should remember that this is the collarbone, sister. So what is this which is passing? This is typically called subclavian vein. Subclavian. Clavicle means collarbone, no? Under the collarbone it is passing, no? इसलिए इसको कहते हैं subclavian vein. So you are piercing this subclavian vein with the catheter, and then you are passing the catheter which enters into the right side of the heart. So this is called a central line, central venous catheter, central venous catheter. But one point you need to understand is The central venous catheter, this is called a non-tunneled one. Matlab, there is something called tunneled one. I'll tell you about tunneled one. टनल का मतलब क्या होता है? गुफा के अंदर से नहीं जा रहे, डायरेक्टली एक पंक्चर करेंगे सबक्लेवियन में और पुश करेंगे and it will enter into the right atrium and you can pass the things through this, right? Now, if you are planning to put a central catheter, central venous line, what are all the things that you should keep ready for the doctor to put a central line? So first, you have a needle and a syringe. This should be ready. Then there should be a scalpel which should be ready. Suppose if you have to make any incision to push the central line, right? A scalpel is required. Then what else? You need to have a sterile gel. This is the gel which is made available, right? Suppose if sometimes we pass the catheter into the subclavian vein and we'll be looking at the subclavian vein through the ultrasound probe. So ultrasound probe अगर इस्तेमाल करें तो जेल लगा के ultrasound probe करना पड़ता, इसलिए ultrasound gel should be ready, right? Then you need to have a 18 gauge catheter, right? So to introduce that, you require to have a introducer needle which should be available. So this is the, remember, this is the needle. First with the needle you have to make a puncture and then push the catheter, right? So you need to have this introducer needle and it will be of how much gauge, sister? 18 is what you need to remember. Then you need to have a guide wire. So this is the guide wire that you are having, right? This is the guide wire. And there is a tissue dilator. This one, when you are passing the catheter, you need to have something to dilate because tissues will apply pressure when you are trying to pass it. So for that you require this tissue dilator. Then you need to have an indwelling catheter which you are able to see. This is the ultimate catheter which is going to go inside and remain inside for a long time. So this is the indwelling catheter. Then you need to have surgical thread. Agar the point where you are puncturing the subclavian, there you have to put sutures, means you need to have the additional fasteners and surgical thread, and you need to have the dressing which should be available. So this is how the tray for the placement of the central venous catheter is made ready, right? Now, so this is a classical example. You are able to see two lumens, and this is the place where the jugular vein, you have gone into the jugular vein, and in this case jugular, and we did not enter this guide wire in the neck, rather we created a tunnel. एक tunnel create करके under the skin, you passed through that tunnel and then inserted it into the jugular vein. So for this we use a special type of catheter which is called Hickman's catheter. What is that called, sister? Hickman's catheter is what you should basically remember. So central venous catheter, Hickman's catheter, is a tunneled catheter, is what you have to basically remember. Now, this is how you should have a clear idea on the anatomy, how it is basically passed, right? Now, so you have a central line inserted into the chest, and the line tunneled under the skin, it can be, and this is the line which comes out if you happen to use a tunnel, skin tunnel, to push it, and finally it enters into the right side of the heart. So this is another example of the catheter with a tunnel. Hickman is what you are able to see here. Now, what are the scenarios where you want to use central venous catheterization? Central vein. What is the other type of vein that you have? You have peripheral vein. Peripheral vein. Peripheral vein. आपके elbow, I mean the brachial vein, cephalic vein, जो हम रेगुलरली डालते हैं उसको पेरिफेरल वेन बोलते हैं. ये जो सबक्लेवियन वेन, जुगुलर वेन, इसको कहते हैं सेंट्रल वेन. सो व्हाट इज द पर्पस of putting a central venous catheterization? Why do you want to put a central venous catheterization is the favorite question of the examiner. Suppose you want to monitor the central venous pressure. You need to put a catheter. Similarly, you want to do pulmonary artery catheterization and monitoring. So now you should know a bit of anatomy of the heart. So you have a right atrium, then right ventricle, left atrium and left ventricle. So right ventricle से निकलेगा pulmonary artery, left ventricle से निकलेगा aorta. So what is draining into the right atrium? Superior vena cava and inferior vena cava. These two are the major blood vessels which are draining into right atrium. So superior vena cava is bringing the blood, superior vena cava, and draining into the right atrium. So whether subclavian vein or jugular vein, they all ultimately enter into the superior vena cava and enter into the right atrium. So if you are passing the catheter, central catheter, it is entering right atrium, from there it enters into right ventricle, and from there it will enter into the pulmonary artery. So that is the reason pulmonary artery ko agar if you want to catheterize, you need to approach through central venous catheter is what you have to basically remember. Right. So then if there is any hemodialysis you are planning, temporarily you need access to the blood. So hemodialysis ke liye. Any chemotherapy, this is what AIIMS examiner is asking. Chemotherapy may hyperalimentation. Suppose somebody is not able to eat food orally, then they need to be given nutrients through the central venous line. So hyperalimentation ke liye. Then if peripherally if you give certain medicines, they will irritate the blood vessel. Such things need to be given, such kind of medicines need to be given central venous line. Suppose if somebody has a prolonged antibiotic therapy, for example endocarditis, heart has valves, right? So valves can get infection, that is called endocarditis. Agar endocarditis ho gaya to inko 6 weeks, 8 weeks, 10 weeks you have to give the antibiotics. For that also it is an indication for central line. Then they are the main things, at least for now, you need to remember for the tomorrow's exam. Now, for the gastric carcinoma, what are all the risk factors? Gastric ka matlab kya hota hai? What is gastric? Let me check what Roja is sleepy or awake. Roja, what is gastric? Gastric is which part? Esophagus, stomach, duodenum, jejunum, ileum. Which one is called gastric? Please punch your answer. Yes. I'm looking for your answer. Keep punching the answers. So I'm very happy that our first student Roja is able to ask questions. Asking questions is the most important thing in life, sister, that always the asking questions is the beginning of knowledge. That's very important. So when patient asks questions also, we should have a patience to listen to them, answer them, give a scientific answer. Take away the fear in their mind. That is the whole purpose of a medical and a nursing team. Very good. Roja says stomach is gastric. Bahut badhiya. So Roja, you did not tell me you have done BSc nursing or diploma nursing. What have you done? Or MSc nursing. What is that you have done? So gastric carcinoma. Please punch your answer. So gastric carcinoma ka risk factors kya hota hai? So now remember, chronic gastritis or taking smoked food. Remember, in Japan, gastric cancer is very high because Japanese eat a lot that smoking noodles, right? So smoked food, very good. Roja, you have done diploma in nursing, very good, very good, very good. So smoked food is one important risk factor. That's the reason Japanese mein zyada hota hai, Chinese mein zyada hota hai gastric carcinoma. Smoking is a risk factor for gastric carcinoma. So you should remember this list, sister. What is this list? What lead to increased risk to get stomach cancer? Family history. Daddy ko hai, uncle ko hai, grandpa ko hai. Any food which is very high in salt or fat is a risk factor. There is a condition called familial polyposis. Polyp ka matlab hai any epithelium which is heaped up like this from the surface, that is called polyp. That is called polyp. Similarly, in the stomach you will have adenomas in few people. Gastric adenomas. Gastric adenomas. Helicobacter pylori infection is also a risk factor. There is an organism called Helicobacter pylori, right? That infection. Then in the past, if somebody has made a gastrectomy ka matlab, you have to cut the stomach. So what is the anatomy here? You have the esophagus, right? You have the esophagus. Then you have the stomach. Stomach becomes duodenum. Duodenum, that become the small intestine, which is called jejunum, right? Now, typically, if the stomach is being resected, then you are directly connecting duodenum with the remaining part of the stomach. So any past gastrectomy is a risk factor. Smoking is a risk factor. Meniere's disease, what is the meaning of it? Typically in Meniere's disease, the stomach, inside the stomach you are having epithelium and mucosa, right? So this become hyperplastic, means it will multiply severely and a lot of multiple folds in the stomach will appear. That condition is called Meniere. That is also a risk factor. So, and what decreases the risk of stomach cancer? That is another favorite question of the examiner. Aspirin. Aspirin decreases the risk. And fresh fruits, fresh vegetables, vitamin C, they all decrease the risk of stomach cancer. You have to be very sure to remember for the tomorrow's exam. So be very sure, if a patient of stomach cancer dies and you happen to do the autopsy, you have taken out his stomach. This is how this is all stomach, sister. In that you are having the mass, which is the stomach cancer. And you can also see the other appearance. You can see that the stomach is very much thickened and you are finding a lot of mass inside, which is basically a classical example of the stomach cancer, is what you have to remember. Now, Roja asks a very good question. Sir, what is the difference between pigtail catheterization and the central line? Beautiful question, beautiful question. See, pigtail catheter का मतलब क्या होता है? I will try to explain you right away. Yes, pigtail. Good question. Yes. See, you have the heart, right? Now, around the heart, you have something called pericardium. Pericardium. Pericardium say you are having fluid sometimes created. What is this fluid called as? Pericardial effusion. What is this called? Pericardial effusion. So, if this effusion become very severe, it will put pressure on the heart and the heart wall will collapse. And that is called tamponade. If the heart wall is collapsed because of a lot of fluid, pericardial effusion, then the heart cannot be able to pump the blood out. Obviously, only when the blood comes inside and if the ventricle is free to expand, then only the ventricle get filled and you can pump the blood into the aorta, right? Into the aorta. So, if you can't do that, then what will happen? The person goes into shock, right? So, in this kind of situations, what is the treatment? Obviously, you have to apply a catheter and you need to basically drain the fluid out. For that, what you use is a pigtail catheter. Pigtail catheter is what you need to basically remember, right? So, whereas central line is something that you are pushing something inside for a long period of time. So that is a fundamental difference between the two, right? Now, so I hope Roja is able to get the point. Now, anaplasia is what? What is anaplasia? Anaplasia का मतलब होता है cells which are undifferentiated. Anaplasia is one minute. Anaplasia is cells that become completely undifferentiated, right? So, Roja, you are able to get the point, right? Very good. Now, there are few terminology, which examiner is going to ask us. You have to be very sure. First one, what is hypoplasia? What is hypoplasia? So you have the cells and the cells became less number, fewer cells, kam ho gaya. You know what is cell? Cell is this one. Cell sab mile to isko kya kehte hain? Let me ask Roja. When cells combine, what is that called as? What is that? When a group of cells become together, what is that called as? What is that called as? What is the term used for a group of cells together? Come on, Roja. It starts with the letter T. Excellent. Tissue. टिश्यू को माइक्रोस्कोप में देखने को हिस्टोलॉजी कहते हैं. Histology looks at a group of cells together, that is tissue. Whereas cytology is the one which is looking at the individual cells. So you should be very sure what is the difference between cytology and histology. So if the cells become decreased, that is called as hypoplasia. So in few girls, the size of the breast is very small. In few people, the size of the breast is big. So when the size of the breast is small, what you call micromastia. So that is an example of hypoplasia. In few people, that will be of a very large size. That is called hyperplasia, right? Now, what is meant by dysplasia? So, typically, if there is a constant irritation, then what will happen? suppose if this is the shape of the cell, I hope you are not able to see this. I'll move myself this side. Yeah, so that you can see it better. Yeah, is the broadcast voice and everything, are they clear, Roja? Can you please punch? Yes. Is the voice, everything is clear? It is not buffering, right? Yes. Very good. Now, dysplasia. So, this is the normal shape of the cell. This became an abnormally shaped cell. The shape of the cell has changed. So, this is an example of dysplasia. But the main difference which you should understand is this typically occurs when there is a constant irritation, like cigarette smoking will make the cells inside the bronchus become dysplastic. But this is reversible. If you remove that irritation, it once more becomes a normal shaped one. Then what is meant by metaplasia? Metaplasia. Typically, in every area, there is a particular type of cell which is meant for that purpose. If you take the bronchus, bronchus has a columnar epithelium, like a column. The cells look like a column. And you have cilia on the top of them. So, ciliated columnar epithelium. और एक बार बोलो मेरे साथ, normal epithelium of the bronchus क्या होता है? Ciliated columnar epithelium is what you need to remember. So, if there is a constant smoking, then the ciliated columnar epithelium become stratified squamous epithelium. Typically become stratified squamous epithelium after prolonged irritation like smoking is what you should remember. So, one cell type has become another cell type. That is called metaplasia, is what you should remember. Then, what is neoplasia? Neoplasia means cancer. It is similar to hyperplasia, but if you look at the cell nucleus, this nucleus is of a different shape, this is different shape, this is different shape. यहाँ साइटोप्लाज्म ज़्यादा है, न्यूक्लियस कम है. यहाँ न्यूक्लियस बड़ा है, साइटोप्लाज्म कम है. So, this kind of different shapes of the cells is called as pleomorphism. Pleomorphism. And this is called as atypia. Atypia. So, Ranjit Shah is joining. He is in first year MBBS student. Basically, Dr. Ranjit, nurses, doctors, medical students, we are all more or less the same team. Only thing is, right from day one they do service. Nurses do service from day one. As medical students, we read a lot of theory and less practice. That's the only difference, right? So, there is a reason always what Mother Teresa said. The hands that work are holier than the lips that pray. The hands that do service and work are holier than the lips that pray. So, that is the reason always the rule is, if you go to UK or US or anywhere, nurses are in fact in a lot of aspects more knowledgeable than a junior doctor. Worldwide, that is the story, right? So you take UK nurses or US nurses or anywhere. So the same kind of professionalism and knowledge, depth of knowledge should also come in our Indian nursing education also. That is my whole idea and goal. And I'm so happy. Roja is our first student, and this is becoming a very popular YouTube portal. Every day, 100, 200, 300 new subscribers keep adding as we keep promoting this. And we will be having a large number of students in this live online interactive session. Yeah. So both Ranjit Shaw and Roja, thanks for attending this session. So this is neoplasia. Only neoplasia main thing is the cells are pleomorphic, the cells are atypical, and the nucleus is more darker. That is called as hyperchromatic nuclei. That is an uncontrolled growth. That is called neoplasia. Now comes a very, very important question. What is anaplasia? This was AIIMS staff nurse recruitment exam का question था. एनाप्लेसिया होता है ए रिवर्सल इन डिफरेंशिएशन, मतलब एक डिफरेंशिएटेड सेल्स जो व्हेन एम्ब्रियो से व्हेन दे गेट क्रिएटेड they will become differentiated. That means every cell has its own shape, look, everything. So that lose the differentiation. That's called de-differentiation. De-differentiation is the hallmark of the anaplasia. That is what a AIIMS examiner asked. Replacement of, the cells that are completely undifferentiated is called anaplasia. Now, I like to ask Roja and Ranjit a question. Replacement of one fully differentiated cell into another fully differentiated cell, isko kya kehte hain? Just before we discussed, what is the term used for the replacement when there is a replacement of one type of fully differentiated cell into another fully differentiated cell? What is that called as? Ranjit says it is metaplasia. Roja, what is your answer? Come on. So, give one confident answer. What do you call when there is a replacement of one type of fully differentiated cell into another fully differentiated cell? What is that called as? Roja must give a word for this quickly. Yeah. So, it is called as, I'm waiting for Roja's answer. It is called as metaplasia. As Ranjit said, it is called as metaplasia. Okay, very good. Roja says anaplasia. No, Roja. Anaplasia means a differentiated cell ban gaya, de-differentiated, undifferentiated cell ban gaya. Right? That is called as anaplasia. Okay, good, good. So, anaplasia is the reversal of the differentiation that lead to development of cancer, malignant, neoplasm is what you need to remember. That means you're going backwards. You're going backwards. So that is called as anaplasia. So now, how do you recognize anaplasia is a very important question. So you should remember that the nucleus and the cytoplasm. Normally, nucleus is small and cytoplasm is more in any cell. But here in this anaplastic cell, nucleus become very big, cytoplasm become very less. So there is an increased nuclear cytoplasmic ratio. Is a very important clue. Hyperchromatism, it become more darker nucleus is a sign of anaplasia. That means it is going to become a cancerous cell. It is getting undifferentiated from a differentiated state. Then pleomorphism, abnormal mitosis, and new blood vessels. That's called angiogenesis. That's called angiogenesis. New blood vessels when they develop, that is called as anaplasia, is what you should basically remember. Now the next question. For how long if chemotherapy is being given? Keep punching your answers. Roja, Ranjit, make a guess. If you guess an answer, it is a fun, right? Your answer may go right or wrong, doesn't matter. If it is a live face-to-face class, you need to worry. Wrong bole to what my friends say, right? Here the purpose is to keep doing wrong. So keep punching your answers. Febrile neutropenia. How does it basically develop? After how many days of chemotherapy does febrile neutropenia develop? Very good. Roja's answer is 3 days of chemotherapy. Ranjit's answer I'm looking for yes. So you should remember, Ranjit should make a guess, quick guess. What is your lucky number, Ranjit? So it is 7 days, almost correct answer. In Kaun Banega government staff nurse program, right? That's good. So the kind of payment salaries that are being given in the private nursing jobs is cruelly small, very small salaries for the lot of work done. Whereas a government staff nursing, very, it's like a gazetted officer salary. It's a respectable salary. So that's the reason everybody's dream is to become that after doing the nursing. And I'm very sure you be with me for 8,000 MCQs like this. We discuss, your concepts are stronger. 100 out of 100. It is a 100 marks paper, most of the nursing exams. 100 out of 100 you should score. That is a goal, right? Now, 7 to 14 days chemotherapy. Now, ultraviolet rays, what do? Which part of our body do they affect? You should remember, ultraviolet rays lead to a damage to the skin. Now, which is a hypertonic solution out of all these solutions, which is the hypertonic solution you should be very sure about. Good. So, Roja and Shaw, Ranjit Shaw, both of you are absolutely right. Now, hypertonic solution out of all this is which one? Keep answering the questions so that it become interesting, right? So it is 50% dextrose को कहते हैं hypertonic solution. Now isotonic, hypotonic, hypertonic. That's how you basically divide the various fluids into. What are they? Let's look into it. Isotonic. First of all, you should know one concept called osmolarity. What is meant by osmolarity? If you take any fluid, if you happen to put a solute, for example, you took sugar, put it into water, that became sugar water. In that the water is called as solvent and sugar is called solute. So if you put any solute in a fluid, then there is a concentration of that solute. Then every solute will try to attract the water. It wants to hold the water. It has an attractive force for water. And that is the reason fluids get a property called osmolarity. Osmolarity is that power of the solute to attract the water which is there in the solvent. That is called as osmolarity. If you take the blood has certain osmolarity, around 280 osmoles per liter, right? So now, if you are administering any fluid into the patient's blood, it may have the similar osmolarity as the blood, then you call isotonic. Less than the osmolarity of the blood, you call hypotonic. More osmolarity than the blood, you call it as hypertonic. So 0.9% NaCl, इसको क्या बोलते हैं हमारे भाषा में, हॉस्पिटल में? Normal saline. Once one nursing student asked me a question, sir, a normal saline है तो abnormal saline क्या होता है? Why do you keep on shouting normal saline लाओ sister, normal saline लाओ? There is nothing abnormal saline. Normal saline का मतलब 0.9% को normal बोलते हैं, right? Whereas 0.45% को half normal saline कहते हैं. It's called half normal saline. And 3% को hypertonic saline. This is called hypertonic saline. 5% also called hypertonic saline. So you need to remember that these fluids, what are the fluids which are called Isotonic, normal saline, ringer lactate, ringer solution, 5% dextrose. ये सारे चीजों को isotonic कहते हैं. We call them isotonic. Then what is hypotonic? Half normal saline, 0.33% saline, 0.2% saline or 2.5% dextrose in water. इसको कहते हैं hypotonic is what you have to basically remember. Hypotonic. Now I am going to move this side. Okay. 3% NaCl, 5% NaCl or 3% NaCl with dextrose water or 5% dextrose, more than 5% dextrose, matlab 50% dextrose if you give, that is called as, or 10% dextrose, 10% dextrose, that is called as hypertonic is what you have to ultimately remember. Now you got the idea, no? Now, one point I want to tell you, sister, definitely asked in the tomorrow's staff nurse exam. Why do you give normal saline? Because it is having NaCl. 0.9% NaCl एक saline bottle में रहता है. Now the question is, एक NaCl normal saline चढ़ाए तो कितना मिली इक्वलेंट्स ऑफ सोडियम अंदर जाएगा? एक नॉर्मल सलाइन बॉटल में, एक लीटर में कितना मिली इक्वलेंट्स ऑफ द सोडियम रहेगा? अगर आप नॉर्मल सलाइन चढ़ाए तो कितना मिली इक्वलेंट चढ़ेगा? 154 मिली इक्वलेंट्स. प्लीज रिमेंबर 154 मिली इक्वलेंट, सिस्टर. 154 milli equivalents is what you have in one normal saline. Whereas hypertonic saline जो होता है, hypertonic saline, इसमें that is we administer 3% NaCl instead of 0.9% NaCl. अगर hypertonic saline चढ़ाए तो 1 लीटर में कितना मिली इक्वलेंट्स ऑफ सोडियम रहेगा? दिस इज फेवरेट क्वेश्चन ऑफ द एग्जामिनर. 514. ये 154 को जरा उल्टा पलटा करो, आपको 514 मिल जाएगा. 514 मिली इक्वलेंट्स रहेगा. दैट इज व्हाट यू नीड टू रिमेंबर. सो when do you give hypertonic solution? Why do you need to give hypertonic solution? See, if somebody has low sodium, serum sodium levels are low. How do you recognize if somebody has got low sodium? If you have low sodium, no? Suppose your blood is having low sodium. When that blood is passing through around your brain, obviously the cells inside the brain have a higher osmolarity compared to the blood which has a low sodium, right? So always the water inside the blood vessel will run into from a point of low osmolarity to high osmolarity, it will run away. So all the water inside the blood vessels ran into the brain, right? So the brain become edema. So that will make the patient become drowsy. So hyponatremia will cause the low osmolarity blood to push water into, that's right, Ranjit Shah rightly says, cerebral edema. Push the water into the brain cells, make brain cells swell, and that lead to development of cerebral edema. So what is the treatment? Obviously you have to give the sodium back to the patient. You have to administer the sodium. So for that you have to give a saline. You have to administer saline. So you have to, if you have to give sodium, you want to introduce sodium into the body, how can you introduce? You can only be able to introduce by by pushing the sodium. Now I will try to make you understand few calculations, right? Now I'll make you understand few calculations. What is the normal serum sodium? Serum sodium कितना रहता है normally? एक आदमी में serum sodium कितना रहता है? Typically 135 milliequivalents per liter to 145 milliequivalents per liter जो होता है. This is the normal serum sodium. Very good to see almost 8 online students. Today a lot of nurses have subscribed to nursenoukri.com channel, and I'm very happy. And don't forget to also click on the bell sign. Bell sign होता है ना channel में, ताकि आपको टिंग बोल के एक notification आता है whenever we conduct a session, right? And the great advantage is morning you may be working in hospital, night we can always have a class. That is an advantage of a live online interactive class, right? Now, serum sodium is 135 to 145. When do you call hyponatremia? When do we call hyponatremia? Hyponatremia. The moment the serum sodium levels falls below 135. So let us say around 120 milliequivalents serum sodium ho gaya. So the person became drowsy because there is a cerebral edema. So to him you have to push the sodium into his body. So how do you know how much sodium if I push I can make 120 become 135? How will you calculate that? How much sodium you have to push? Remember, 60% of our body weight, of our weight is water. Please remember. So, if you take a 70 kg man, got it? 60% of his body weight means 42 kgs. 42 kgs, क्या हो गया? Water, right? So, from 120 you have to raise the concentration to 135, means 15 milliequivalents for every liter you have to increase. So 42 kgs man में 15 milliequivalents per liter देना है, तो कितना milliequivalents दिए तो उनका लेवल सीरम सोडियम लेवल 122 नॉर्मल 135 बन जाएगा? कैसे बनेगा? You have to give 15 milliequivalents, which is the difference between his value and the normal value. That out of per liter. So in a 60 kg man, in 70 kg man, 60% is 42 liters. में every liter में 15 milliequivalents you have to increase serum sodium. So 42 into 15 means around 600 milliequivalents you have to give. 600 milliequivalents of sodium उनको दे दिए तो उनके body में चढ़ाए तो इनका this low sodium 120 will come back to 135. So if you in order to push this sodium into his body, suppose if you have taken normal saline में 1 लीटर में कितना रहता? 4 liters normal saline चढ़ाना पड़ता, मतलब almost 8 saline bottles चलाना पड़ता, which is very difficult. So you don't want to choose normal saline to give his sodium. Instead you will take 3% saline को चूज करते आप किसको चूज करते? 3% saline को चूज करेगा आप. 3% saline में each liter has 514 milliequivalents of sodium. So अगर आप 3% saline को चूज लिया समझो, then 1 liter चढ़ाए तो ही आपका 600 milliequivalent चढ़ गया, almost 514 milliequivalent चढ़ गया. So 1 liter को चढ़ाना, 1 liter of saline को चढ़ाना easy है या 4 liters saline को चढ़ाना easy है, 1 liter is easier. So to treat hyponatremia, which is very severe, right? In order to use less amount of saline to push the required sodium into the body, you will choose hypertonic fluid like 3% saline instead of normal saline, which is 0.9% saline is what you need to remember, right? Roja is asking, sir, will same class will conduct in morning and evening? No. एक बार हम बताए वीडियो डिलीवर हुआ तो दूसरे बार बताने का जरूरत नहीं है, right? So whenever, suppose sometimes I get time in the morning, so sometimes I get time in the evening. So whenever the time is there, sometimes I may get time in the morning and evening also. We will conduct during both the times. You will get a notification. Even if you miss the class, no worries. You have all this video library available in the nursenoukri.com, where you can buy the subscription. Very small price you can pay and buy the subscription, and you can be able to do the revision of the video. And you also have all these PowerPoints made available in the nursenoukri.com. So no worries, right? Now, let's come back. Yes, the advantage of a online class is even if you are hungry in the home, you can nicely eat and attend the lecture. Even if it is midnight, you can attend the lecture. That is a great advantage. You don't need to travel and waste time in traveling, right? Now, let's take up the next question. So, what are the classical examples of hypertonic saline? You should be very sure. Yeah. 3% sodium chloride. Severe hyponatremia, if it is there, you will give. 5% dextrose with normal saline, which replaces sodium chloride and also some calories. They're all the examples. Now, which is the history that increases the risk of surgical procedure? Can you please tell me, guess the answer? Ranjit and Roja, what is your answer? Yes. In the history, what is that which increases the risk from a surgical procedure? Yes. So, you think daily, if the patient is taking, is having a history that he is taking daily thyroxine, a lot of people take thyroxine for hypothyroidism. Is it a risk? Ranjit thinks all of the above. Then Roja also thinks it is all of the above. No. Drug abuse is the risk, increase the risk. Previous surgery, daily taking thyroxine is not really an increase of the risk. Now, what are the components of the granulation tissue? Let's talk about it. Granulation tissue. So, first of all, what is granulation tissue? What is a wound? We'll talk about it in a great detail. Because as a nurse, managing the wound is one of the major activities, right? So, you must be knowing pathophysiology, what is the nursing management, and also how are you going to, what are the things you need to be very sure. Now, all of them, angiogenesis, fibroblasts, chronic inflammatory cells, all of them will be the components of the granulation tissue. Now, what is a wound? Wound is a breach. Breach means breakdown in the body surface leading to the disruption of the tissue. Now, if you look at our skin, yeah, I'll try to move that side. Now, you have, what are the layers of our skin? You have epidermis, after that you have a dermis, under that you have a subcutaneous tissue and the connective tissue, finally muscle. So, these are the various layers of our skin. Okay. Now, suppose if only epidermis is injured, if there is a breach in that, you call superficial wound. Then, if the dermis and epidermis, if there is a breach, you call partial thickness, yes. And if there is a involvement of epidermis, dermis and subcutaneous, everything, that you call full thickness, right? Now, what is the healing? Healing is the response to the injury to restore the normal structure and the function. That's called healing. Now, if you take our cells, there are three kinds of cells that are there in our body, which you have to be very sure about. Labile cells, stable cells, permanent cells. What do you mean by labile? Labile means every day they keep on multiplying. They are continuously replicating. That is called labile. So, bone marrow, skin, they are examples of labile cells. Then you have stable. Stable means they don't regularly multiply, but if requirement is there, they will multiply. Permanent. Permanent are the nervous tissue. Permanent. That is, after birth, it won't multiply at all. Is the permanent cell is what you have to remember. So now, if you look at the repair, what are the various stages of repair? First, the moment there is any wound, injury, hemostasis, bleeding should be stopped. For that, there is a fibrin clot, platelet deposition, platelets come, hemostasis होता है. बाद में इन्फ्लेमेशन होता है, इसलिए हमको जब भी वुंड होता है पेन क्यों लगता है? इन्फ्लेमेशन के वजह से. So the WBCs, macrophages, lymphocytes, they all will come to that place. Then you get proliferation. New blood vessels will grow there. Epithelium regrows, and that is called proliferation. Finally, remodeling. Once more, the skin on the thumb, the skin on the back of the palm. There are different kinds of skin, no? So when the wound is healing, same type of skin should come. So remodeling hota hai. So if you look at the granulation tissue, there is a phase of inflammation, phase of clearance, and phase of ingrowth of granulation tissue. So when the granulation tissue forms, there is angiogenesis. Angio का मतलब है blood vessel. Angio का मतलब है blood vessel. Right. Angiogenesis and fibrogenesis. These are the two things you need to remember when there is a granulation. So this is called angiogenesis. So you can see here that this is the vessel, capillaries are growing, and a mature network of capillaries has formed. This is the angiogenesis that happens whenever the wound is healing, is what you should remember. So there is a growth factor which is called vascular endothelial growth factor. Vascular endothelium को ग्रो करने वाला फैक्टर होता है. ये आके स्टिमुलेट करेगा neovascularization को. Similarly, there is a growth factors which are coming from the platelets. Platelets are also, platelet means we will only think it is meant for the purpose of clot formation, but platelet is like an atom bomb sister. Remember, it contains a lot of chemical mediators. One of them is the platelet derived growth factor. It will also help for the wound to heal. Then there is a TGF alpha that is called tissue growth factor, tumor growth factor alpha. It is called as. These are the various growth factors which are produced. Then there are a type of cells called as fibroblasts. आपको BCG का टीका लगाए ना, टीका लगाने के बाद बचपन में you get a scar, BCG scar. So what do you have? What is forming that scar? It is the fibroblasts which are forming the scar over there. And by 6th day, Remember, this is a favorite question of the examiner. By what day collagen comes and deposits is a very, very important question. By 6th day, the collagen comes and deposits is what you have to basically remember. Then the wound, after it got healed, it will start contracting. So contraction of the wound starts within 2 to 3 days. By 14th day it is over, and by the 14th day, wound becomes reduced to almost 80% of its original size. So this is how the wound healing process occurs. So you will see a lot of diabetic patients who are having wounds. You also see paralysis patients who are bedridden for a long period of time. They develop bed sores. They are also wounds. So if you know what is all happening inside, you become more knowledgeable to treat the patients tomorrow, right? So that is the reason. So 2 types of healing occur in a wound. One is called healing by primary intention. Second is called healing by secondary intention, which you have to be very sure about. So healing by primary intention, इसका मतलब क्या होता है? Typically a clean wound, a wound which is not infected, or a wound that we make at the time of surgery, surgically incised wound, where the tissue loss, cell loss is not too much, and there the edges of the wound, they become approximated if you put a surgical suture lagane se. So you have a wound, this is one edge, other edge, here you have put a surgical suture. That kind of a healing is called healing by primary intention, is what you have to basically remember. So you can see here the whole story. Immediately after the injury, the wound is filled with blood which clots and seals this wound. You know, this is the wound margins. Into that the bleeding occurs and it will seal it. Then there is an acute inflammatory response which occurs within about 24 hours. Inflammatory cells. Inflammation का मतलब क्या होता है? आपका white blood cells वो सब रहता है ना, sister. So they all will come there. It occurs within 24 hours. White blood cells को बोलते हैं polymorphs. They typically appear, neutrophils, etc. And by 3rd day, the neutrophils are replaced by macrophages. So this is the acute inflammatory response. Then after that, epithelialization occurs. Epithelium will grow. Epithelium will start growing, right, to fill the gap. By 5th day, there will be a newly formed epidermis that you typically see. Then typically the fibroblasts come, they put the collagen and the scar tissue form, and in about 4 weeks you will find the presence of the scar tissue organization occur. And this is how the healing by primary intention, where you can be able to apply the sutures and it is a clean wound. Then what is meant by healing by secondary intention? A large tissue defect hai samjho. It is not a fine one, large tissue defect. Extensive loss of cells is there. And you can't be able to put a suture and approximate the margins. And the healing will take, typically if this is the wound, from the base upwards and from the margin inwards. That's how it takes, and a large scar will form. So you can see classically, this is the wound, the platelets, RBCs, everything, but there's a big gap. Fibrin comes and deposits there. Initially there is a hemorrhage where the blood fills this clotted area, right? Then later on there is a inflammation, early and late inflammation. This is the inflammatory phase where macrophages come and clear the debris, right? Then epithelial changes occur, and what is formed? Granulation tissue is formed. That is what examiner is trying to ask. So when you are doing ward rounds, What is a surgeon looking for? What is a nurse looking for? We look whether wound is healing or not. How do you know wound is healing or not? You look whether granulation tissue is forming or not. So granulation tissue formation is a sign that the wound is healing, is what you will be able to understand. Finally, wound contracts to 1/3 to 1/4 of its size and a collagen scar will form, is what you have to remember. So let us quickly summarize that Ranjit Shah is asking, sir, I need your help. I want to attend your quiz classes on MBBS subjects, and later on when I will be in 4th year, I will pay for your subscription. You should remember one thing. I had been teaching students almost 2 decades. Never we did this for money. Money automatically students pay the fee. We never asked them, they pay the fee. That's not a big deal. So no worries at all. No worries at all, Ranjit. So, and even Rojo also, I want to tell that you top that staff nurse recruitment exam and come and say that I joined today in AIIMS. That is the happiest day for me, any given day, right? So no worries at all. Now, primary is a clean, secondary healing by secondary intention is not clean. Margins are surgically clean, whereas they are irregular in secondary. Sutures are used in primary, healing by primary intention. Granulation tissue is very little in case of the primary, and it is a linear scar. And complications are not that frequent. So this is the primary and secondary intention. Now what are the complications of the wounds? The wound healing. Infection, pigmentation can occur, and a scar will form that is very weak, and that can lead to the contents to come out. Typically after you do hysterectomy, cesarean or any surgery, if the abdominal wall while healing, if that scar is weak, that can lead to development of hernia. Hernia means protrusion of the abdominal contents out, is called hernia. So herniation can occur. So these are all the issues. So what you are seeing here is at the time of healing, some people, there can be a hypertrophied scar, a scar which is looking ugly, hypertrophied scar, or there can be a keloid like this, which can form when the wound is healing. The scar can lead to the formation of the keloid. But the main difference is, if this is the wound, a hypertrophied scar is confined to the margins of that wound, whereas keloid expands everywhere. It overgrows the margins. That is the keloid tumor, is what you have to basically remember. There can be excessive contraction, especially burns की वजह से होने वाले wounds. They can lead to development of contractures. Contracture means that excessive fibrosis will make the contracture to develop, and there can be development of cancer from that scar tissue. A squamous cell carcinoma can develop. That is called a Marjolin's ulcer. What is the name given for that? If a cancer develops from a wound which has healed, it's called Marjolin's ulcer, is what you have to basically remember. Now comes a very, very important question that all of you should be very sure about. What are the factors that affect the wound healing? The main factors that affect the wound healing are oxygenation. If oxygenation is good, healing is better. इसलिए we use what is called as hyperbaric oxygen therapy. Hyperbaric means with high pressure you apply oxygen in order to improve the healing of a diabetic wound. Hyperbaric oxygen therapy is used. So oxygen, infection will prevent the healing. Any foreign body wound ke andar hai to it will prevent healing. Similarly, venous insufficiency. A lot of patients with varicose veins we see every day in the hospital. Varicose veins, right? So varicose veins. So when varicose veins are there, there is development of ulcers. Ulcers typically along the medial surface of the leg. So they also will be little slow in healing. How many days will take to heal a fasciotomy wound, sir? Excellent question, Roja. So typically any wound takes about 6 weeks, 1.5 months is a typical time. By the time collagen comes, contraction of the wound occur, etc. happen. Similarly, the age, the gender, male or female, sex hormones, stress, ischemia, diseases like diabetes, keloids, jaundice, uremia, even renal failure patients may, when there are wounds, healing will be delayed. Obesity will delay the wound healing. If the patient is on steroid therapy or chemotherapy, the wound healing become delayed. Alcoholism, smoking, immunocompromised conditions like cancer, radiation therapy, they all will slow down the healing is what you have to basically remember. Now, oxygenation, very important. Hypoxia. Hypoxia is the one oxygen should be sufficiently provided. So, hyperbaric oxygen therapy is the one which is used. So, this is a diabetic patient and you have given a hyperbaric oxygen therapy. Hyperbaric oxygen therapy and after 50 completed hyperbaric oxygen therapy sessions, the diabetic ulcer healed very well. That is what you have to remember. Similarly, infections. The skin which is injured, microorganisms will get an access and they will delay. Now, the next question. Examination of the external ear and the tympanic membrane inside the eardrum को देखने के लिए किसका इस्तेमाल करते हैं? What is this instrument which is used for observing called as? Keep punching your answers. Roja and Ranjit for today's evening. Within a short period of time, we will have about 10,000, 20,000 online subscribers of the YouTube. So Roja, you also tell your classmates to subscribe to the nursenaukri.com YouTube channel, right? And we'll have a lot of students punching the answers. That will be a very exciting, interesting session to conduct. Yes. So this is called, very good. Roja says otoscope. Absolutely right. So typically, this is a 5.5 millimeter camera which is used in order to look into the eardrum. So when you look through a otoscope, if there is a wax in the ear, typically it looks like this. If there is a wax in the ear. So this is how a otoscopic examination is done. Nowadays, ENT surgeons are using monitor. Directly this is connected with the monitor. In the monitor, आप देख सकते हैं, just like endoscopy, right? Now, protrusion of the mucous membrane of the nose and the paranasal sinus, what is that called as? It is called nasal polyp. So this is how typically a nasal polyp looks like. Polyp looks like. In children it can occur. Similarly, we have a lot of air sinuses. What are the various air sinuses that you know? Ethmoid, frontal, air sinus. We get a headache now when we get common cold because sinusitis occurs. So ethmoid, right? Maxillary. So these paranasal sinuses also, there can be development of a protrusion of the mucosa, which is called as polyp, is what you need to remember. Very good. So nasal polyp is the hypertrophied, edematous, prolapsed mucus of the nose and the paranasal sinus. It is grey in color, it is glistening, it has a smooth surface, it is pedunculated, So a polyp, if it is having a stalk, that's called pedunculated. Pedunculated is a word, right? It is insensitive to pain. It is mobile. If you happen to move, if you move this, it can be mobile, and it does not bleed. Typically, a nasal polyp, it does not bleed if you are trying to probe it. These are the features of the polyp. Now, what lead to the development of these polyps is a very important question. So, people who have allergic rhinitis, fungal sinusitis, asthma patients, they have the development of the polyps. Cystic fibrosis patients have polyps, right? Cartigenous syndrome, in these patients, they have tendency for nasal polyps. So what is cartigenous syndrome? Typically their bronchi. So what is a bronchi, sister? Trachea become bronchi, right? This bronchi can develop, the wall of the bronchi typically develop pouches, dilatation. That's called bronchiectasis. So they can have bronchiectasis, chronic sinusitis, and typically there are cilia in our epithelium, respiratory epithelium. Their cilia cannot move. That's called ciliary dyskinesia. So cartigenous syndrome, nickel, exposure to nickel, a lot of times in the ornaments, nickel is there. So there are all the various causes for the development of the polyps. Mainly you should remember allergic sinusitis, asthma patients have a tendency to form the nasal polyps is what you should basically remember. Now, CPAP stands for what? What is CPAP? CPAP का मतलब है continuous positive airway pressure. Continuous positive airway pressure. Now, I'm going to make you experts in this subject. People smoke, right? The people who smoke, what do they get? They get COPD, chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease. Chronic pulmonary obstructive pulmonary disease. So first of all, what is the structure? What is the structure? Trachea become bronchi, and the bronchi typically become smaller bronchi. They are called bronchioles. What are they called? Bronchioles. Bronchioles ultimately will become alveolus. They become alveolus. Right? Alveolus are like your balloons. And your pulmonary, the blood vessels in the lung are called pulmonary blood vessel, pulmonary veins. Right? So pulmonary blood vessel is carrying the blood. So the air comes from the trachea through the bronchi, through the bronchioles into the alveolus, and here it brought the oxygen. Right? So this oxygen should enter into the pulmonary vein so that the blood become oxygenated, and the carbon dioxide which is there in the pulmonary vein should get into the alveolus, and it will be breathed out. Now, when the air is passing from trachea and through the bronchi into the bronchioles, right? What happens is continuously there is a pressure in our thorax. Where are the lungs located? So the lungs are located inside our rib cage, right? Inside our rib cage. So there is a lot of pressure in our rib cage. That pressure will try to collapse our airways. It will try to collapse our airways, right? Collapse our airways. Normally, who prevents this collapse? These balloons are there, no? Alveolus. Their wall has a lot of elasticity. They are very much elastic. And that elasticity will lead to a pressure will generate pressure, positive pressure inside the airways, inside the bronchi, bronchioles and everywhere. The elasticity of the wall will provide that positive pressure. That is the one which is preventing these small airways from getting collapsed because of this outside pressure, pressure outside, it prevents it. Suppose if someone smokes a lot and their alveoli are all damaged, what is that condition called? Emphysema. It's called emphysema. When there is an emphysema, when the elasticity of this alveoli decreases, the pressure inside the bronchioles decrease. When the pressure inside the bronchioles decrease, the outside pressure will try to collapse it. Outside pressure will collapse it. So, when it get collapsed, no, the gaseous exchange cannot occur. Oxygen अंदर नहीं जा सकता, carbon dioxide बाहर नहीं निकल सकता. अरे बाप, दिक्कत हो गया. तो, how do you manage a patient of emphysema whose small airways are all collapsed because of the loss of elasticity due to the destruction of their alveoli? How are you going to help them? You blow the air with a lot of pressure, with positive pressure inside the bronchi. So that what will happen, if you blow using a machine with a positive pressure, that won't let these small airways to not collapse. If they don't collapse, oxygen exchange will become normal. So that is the reason emphysema patients को typically, yeah, Roja is asking a very good question. Sir, what is the difference between emphysematous patient and bronchitis patient? How will be the shape of his chest, right? So that's a very good question. Generally, emphysematous patients, typically their lungs are not elastic anymore. They're all hyperinflated. Matlab, whatever the air comes will blow them and their lungs are very big, right? Lungs have become big. So typically their chest also, the shape of the chest will also alter because of the hyperinflated lungs, right? So this treatment to blow the air with a positive pressure into the bronchi to maintain their patency, that is called continuous positive airway pressure. CPAP therapy is what you have to basically remember. CPAP therapy, right? Now, let's go back to the to our session. So CPAP stands for what? Fatafat bolo. Continuous positive airway pressure is what you need to remember. So this is how a patient can comfortably put a CPAP machine. And very good. We have Nagappa Burra who joined. Very good. Nagappa, from which part of the country you are? Nagappa. And you are preparing for which staff nurse exam? Now, and what have you done? Diploma nursing or BSc nursing? What have you done? These are the three things Nagappa is going to tell us. Very good, very good. So you should remember that this is the CPAP machine. Lot of patients, home CPAP machine is available now, right? So this is another example. A patient very comfortably sleeping. If the CPAP would not have been there, all his small airways, very good. CPAP is from, Nagappa is from Karnataka. Excellent, excellent. And yeah, continuous positive airway pressure, right? Now this is another example. Very good. Nagappa finished BSc Nursing. Excellent. So what is the next exam you are preparing, Nagappa? So Nagappa and Roja, you are going to bring a lot of your classmates. Don't forget on the YouTube channel, subscribe it and also click on the bell sign so that suddenly if I get time at midnight, 12 o'clock, I can deliver a couple of hours of live online broadcast. The moment we start the session, you will get a notification so that if you are awake and still studying and preparing at that time, you can join the session. Morning, if I get time, a couple of hours, definitely I will be delivering a live session. Very good. Nagappa is preparing for the AIIMS Delhi BSc Staff Nurse exam preparation. Excellent, excellent. And remember, there are totally 8,000 MCQs from 14 subjects that I am going to discuss with you. Right? And on the nursenoukri.com, you have a video library. All these sessions, the video lectures, PowerPoints, everything become uploaded into that after the session is over. And you can always do a revision by subscribing to it, right? And we will discuss a lot of questions of the staff nurse exam of the RRB, NCLEX questions, and the Public Service Commission recent exam questions. All these things we will discuss and we will finish all the 14 subjects and 8,000 MCQs in this live online classes, right? Tell your friends, ask them to also join the session and subscribe to this YouTube channel. So this is another example of a CPAP machine. So how does CPAP function? So it increases the pressure within the airway, and the airways which are at the risk of undergoing a collapse are prevented from getting collapsed so that the gaseous exchange is maintained very well. That's how the CPAP basically work. So is there any protective mechanism God has given us so that small airways don't collapse? God has given us surfactant. Surfactant. From where is surfactant produced? Nagappa, what are the cells that produce surfactant? Give me your answer. Yes. What are the cells which produce surfactant are called as? Anybody? Yeah? So that is a homework for you. From where is the surfactant produced? And what is that condition in newborn child if surfactant is not produced? That is called hyaline membrane disease. Hyaline membrane disease, where preterm babies, their surfactant production is not adequate. Excellent. Ranjit Shaw rightly answers type 2 pneumocyte. Type 2 pneumocyte is the one typically which is producing. Very good. Very good. So that is the one which normally prevents the collapse of small airways. So please remember, before CPAP, after CPAP. Before CPAP, the pressure inside is very little, 0 only. But after CPAP, you got plus 10. Increased pressure within the alveolus, that is keeping it patent, is what you have to remember. So similarly, you can see without CPAP, the airway is obstructed. That's what you are able to see here. Whereas the CPAP has increased the expansion of the lungs, and the pressure inside the airway will pull the lungs up and increase the space available for the lungs to expand. I'll try to move that side. Yeah, you can see. When the positive pressure is applied, typically the lungs are pulled up and there is a increased lung expansion, scope for increased lung expansion. That is what you have to basically remember. Now, a MAN2 test is being performed in a nurse who is working in a TB clinic. If you do that, what do you find the MAN2 test? Come on, Nagappa, Roja, Ranjit, give your positive possible answer. Yes. What will happen if you do the man to a nurse who is already working in a TB clinic? Roja says a positive skin test. Ranjit says probably she's suffering from TB. Okay. What is Nagappa's answer? Let me see. What is Nagappa's answer? So you should remember that Roja is absolutely right. A positive skin test. Once more, you should remember, how do we do this man-to test? Typically, a person who is exposed to the mycobacterium, TB is caused by Mycobacterium tuberculosis. So the one who is exposed to that, his immune system, the T cell, it got sensitized. So to that sensitized T cell, if you happen to give a intradermal soluble tuberculin molecule in the form of the MAN2, then that will make the sensitized cell to get activated. This activated cell will produce interleukin 2, interferon gamma, interleukin 1, TNF alpha. All these inflammatory mediators are being produced, and that will attract a lot of macrophages to come. And this macrophage recruitment and activation will typically lead to that edematous indurated. Induration का मतलब है, what is the meaning of induration? Hardening. Hardening is called indupation. Induration. Hardening. Anything which is hard is called smooth. Hard is called induration. So that induration, erythema. Erythema means redness. The redness, erythema, and induration is what you typically see, which is called MAN2 positive. So how will you interpret whether, so what is ultimately MAN2 test is telling? MAN2 test is not telling whether you have an active TB or not. It is only telling one thing. Are you sensitized? That means, do you have exposure? Exposure. Does your body has exposure to the mycobacterium? It is only telling that. It is not telling anything that you have disease. Please remember, it is only an indicator. It is not a diagnostic. If MAN2 is positive का मतलब you have TB का मतलब नहीं है. That is a point you need to remember. Then another thing, how strong is this MAN2? That is another thing you should be very sure about before you call the person MAN2 positive, right? So suppose if he is HIV positive, then typically when IL-2, IFN, gamma, interferon gamma, they are all produced by whom? The CD4 T cells. But a HIV positive person, his CD4 count is low. So even if you expose him to this soluble tuberculin molecule, there is no T cell available to produce all these mediators. So the MAN2 can still remain negative, or there may be a small reaction in case of HIV positive individual. So that is the reason you should remember, even more than 5 mm of MAN2 is enough in HIV positive person. Or suppose if you contacted, if somebody in the family already has an active TB and you got exposed, even more than 5 mm is enough. Or suppose on the chest X-ray already nodular fibrotic changes like TB is looking, and even if MAN2 is more than 5 mm is called positive. Then similarly, organ transplant patients, we give immunosuppressive drugs. Their immune system is all suppressed. Even in them, more than 5 mm is considered to be positive. Then when do you consider more than 10 mm of the diameter of the MAN2 reaction as a positive reaction? If any recent antiviral therapy if he has taken, IV drug abusers, Then if there are some comorbid means when you get a disease, you get a suffering. That's called morbidity. Mortality means death, right? So comorbid conditions, diabetes, etc. Children less than 4 years of age, infants who are exposed to high risk categories. So they're all the people, more than 10 mm is enough to call. Suppose if there are no risk factors for TB at all, healthy, hailing individual, unless the size of the reaction is more than 15 mm, you don't call it as a positive MAN2. So that is the reason. Agar a nurse who is working in TB clinic, every day she is exposed. So if you do MAN2, obviously she will have a positive skin test. But that does not mean she has an active TB. Then, another important point you should know about MAN2. MAN2 is not a diagnostic test. Is not a diagnostic test. But MAN2 is a prognostic test. Matlab kya hai? If somebody has shown a strong 15 mm induration means his cell-mediated immunity is there or not. Does he have that cell-mediated immunity or not? Very good question by Roja. Sir, how do we diagnose multi-drug resistant TB? Super. I'll tell. But before that, so now you tell me, if somebody mounted more than 15 mm, what does it say? If he has a good cell-mediated immunity, can he produce a strong MAN2? Or if his cell-mediated immunity, that is his T cells are low, he will do that? Right? Give me an answer. Roja, Nagappa, Ranjit, what is your answer? If somebody mounted a positive, strongly positive MAN2 ka matlab, how is his cell-mediated immunity? That means how is his T cells and everything? They are good or bad is my question to all of you. Quick answer. We'll make it interactive. So, if induration is strongly there, Nagappa thinks bad. Roja says that means T lymphocytes are high, sir. Ranjit Shah says good immunity. Absolutely. If you have HIV, if the patient is having HIV, if his immunity T cells are low, then if you do MAN2, even if he has got TB, he can't show induration, significant induration. But if somebody has shown a significant induration means, how is that induration caused? Induration is caused, that erythema induration MAN2 reaction is caused only if macrophages are there, only if the T cells are adequate. That means it is a sign of good T cells. That is a good prognosis. Good prognosis. So, a strongly positive MAN2 means good cell-mediated immunity, 100 out of 100 marks, and a good prognosis. A negative MAN2 means two possibilities. Either he doesn't have TB or exposure to TB, or second possibility, he may be having TB, but his cell-mediated immunity is weak. That is the meaning of it. So that is the reason. What is the very important statement you have learned today evening, sister? You have learned that MAN2 is not a diagnostic test. It does not diagnose the TB. TB nahi hai, cell-mediated immunity अच्छा hai, right? We don't know. So it does not diagnose. But it is a good sign of prognosis. If it is strongly positive, that means at least one thing you know, that his cell-mediated immunity is good, is what you have to basically remember. So how do you do the MAN2? That's very important. Typically you have an epidermis, below that you have dermis. So intradermal, it is not subcutaneous. Intradermal injection you will be doing of the PPD. PPD means purified protein derivative. प्रोटीन डेरिवेटिव. सो बाइकोबैक्टीरियम्स प्रोटीन को प्यूरिफाई करके उसको पीपीडी बोलते हैं. You will inject into dermis. Then that lead to a small bleb formation. Bleb will form. And typically 5 to 9 millimeter, if it is of the size, then you call category 1 positive, and 10 to 14 is called category 2 and positive. More than 15 is called strongly positive, is what you have to basically remember. Now, 2 questions from Roja. How do you diagnose multi-drug resistant TB? Very simple. TB treatment you have given, and you will try to do the sputum AFB. Suppose in spite of taking treatment, AFB is still positive. Then you will send the sputum for BACTEC test. BACTEC test. So in this test, you will look at the sensitivity to various TB drugs. How is the sensitivity? Especially isoniazid, rifampicin, how is the sensitivity? If multiple drugs, especially INH, rifampicin, if there is a resistance, then you call it as multi-drug resistant TB. So you will send for BACTEC test to diagnose the resistance. Then Roja is asking another question. How will you diagnose TB in children? Anybody, fundamentally, it is a sputum examination, chest radiograph is what you will order in order to make the diagnosis. So let us see a few examples. This is an example of a strongly positive man to 30 millimeters in induration, 3 centimeters is what you need to remember. So with this, today we call it a day, sister. So Nagappa and Ranjit, Roja, today our first live online class. You are all the participants. We will grow into a very big number. Thousands of students attending every day across the country. But today evening will always be remembered with a great memory, you being the first students who have attended this session. So thank you so much for participating. And tomorrow once more morning 10 a.m. we have a live broadcast. Ask your friends also to join, and don't forget to buy the subscription in the nursenaukri.com where you have the entire video library made available. Thank you so much. Good night.